Today we are demonstrating the surgical correction of an umbilical hernia in a calf. Before starting the surgery, the animal is properly restrained in a comfortable position to reduce stress and prevent sudden movement. The surgical site is then thoroughly cleaned to remove dirt, manure and surface contamination. Proper cleaning of the area is a critical step, as it significantly reduces the risk of introducing bacteria into the surgical wound. Cleanliness at this stage directly affects the success of the surgery and post-operative healing. After cleaning, the hair around the umbilical region is completely shaved. Shaving helps to clearly expose the surgical field and allows better contact of antiseptic solutions with the skin. Local anesthesia is then administered around the umbilical area. The anesthetic is infiltrated carefully to block pain sensation and keep the animal calm throughout the procedure. Adequate anesthesia is essential not only for animal welfare but also to allow the surgeon to perform the operation smoothly and safely without sudden movement. After confirming that the anesthesia has taken effect, a careful skin incision is made over the umbilical region. The incision is performed gently to avoid unnecessary tissue damage. The hernial sac is then exposed and opened slowly to access the contents. During this stage, close attention is paid to any bleeding, and hemorrhage is carefully checked and controlled to prevent excessive blood loss. Once bleeding is under control, the umbilical cord and surrounding tissues are carefully examined. The umbilical cord is slowly and methodically separated from the surrounding structures. This step requires patience and precision to avoid injury to nearby tissues and organs. Proper separation is crucial for successful correction of the hernia. After complete separation, the umbilical cord is fully removed. Removal of the affected cord corrects the hernia defect and allows the abdominal contents to return to their normal position. At this stage, the surgical field is inspected again to ensure there is no active bleeding or tissue damage. After making the skin incision, the skin and subcutaneous tissues are carefully separated to clearly expose the umbilical cord. Blunt and sharp dissection is performed gently to avoid damage to surrounding structures. Once the cord is fully exposed, the hernial sac is opened slowly, allowing clear visualization of the contents. At this stage, the area is examined for any adhesions, abnormal tissues, or bleeding. Careful handling during this step is important to maintain tissue integrity and prepare the cord for safe separation and removal. After cutting and removing the umbilical cord, attention is given to the hernial ring. The edges of the ring are carefully examined to ensure there is no remaining damaged tissue or active bleeding. Any minor hemorrhage is controlled before proceeding further. The hernial opening is then closed using an absorbable suture material, commonly catgut, which provides adequate strength during healing and does not require removal later. Suturing is performed carefully to bring the edges of the ring together without excessive tension, ensuring proper closure of the abdominal wall. Correct suturing of the hernial ring is a critical step, as it prevents recurrence of the hernia and promotes strong tissue healing. Once the ring is securely closed, the surgical site is rechecked before proceeding to skin closure. The next step involves suturing. The muscle layers are closed carefully using appropriate suture material to restore the abdominal wall strength. Proper closure of the muscle layer is essential to prevent recurrence of the hernia. After the muscle layer is secured, the skin is sutured neatly to close the surgical wound. Following suturing, the surgical site is cleaned once more, and antiseptic is applied to protect the wound. Post-operative care plays a vital role in recovery. The animal should be kept in a clean, dry environment, and the wound should be monitored regularly for signs of infection, swelling, or discharge. Antibiotics and supportive treatment may be given as advised by a veterinarian. With proper surgical technique and good post-operative care, animals undergoing umbilical hernia correction usually recover well and return to normal growth and productivity. Early intervention greatly improves the outcome and prevents future complications. Thank you for watching this veterinary surgical procedure. If you found this video informative and helpful, please like, share, and subscribe to our channel for more educational veterinary content.